Bismillahirrahmanirrahim. Wish you a very good afternoon. So I'm dedicating this video for medical students and other professional doctors. So let's discuss a bit about delirium. Always remember delirium is a medical emergency, but it presents with psychiatric symptoms. Like for example, if patient is admitted at an ICU or NICU, ICU, when you find that the patient has fluctuations in orientation, patient's speech or thoughts are disorganized, they may present with some delusions, they might have some kind of hallucinations, and they might have some kind of paranoia. So remember that this is not something very primarily psychiatric. These are secondary psychiatric conditions, but this is a medical emergency. Now let's discuss a bit about etiology of delirium. So when we talk about infectious causes, any infection can lead to delirium. In that particular scenarios, if the patient has developed fever, it could be because of other metabolic conditions like hyperglycemia, hypoglycemia. These are very common. Or in infectious causes, if patient has developed fever, high-grade fever, or in systematic causes, if the patient has presented with a stroke, CVA or TIA with respiratory failure, renal failure or hepatic failure, the patient can present with psychiatric symptoms. Always remember the level of orientation just fluctuates over the period of hours and days. Family or you will find that the patient is recognizing time, place and person, and after 5 minutes you will see that again the orientation is disturbed, and this time period may vary from 5 minutes to 1 hour, or can vary over a period of 24 hours as well. So we did talk about etiology. Now how to manage delirium. So as I have mentioned earlier, we always have to treat primary medical cause, and then lower doses of antipsychotic medications we can prescribe, but always be very careful before prescribing antipsychotic medications. Make sure patient's QTC interval, which is 470 milliseconds for females and around 440 milliseconds for males, you have to make sure. And rest of the management, which is very vital for delirium, is orientation therapy. Tell primary team to keep the same staff so that they can have a familiarization with same faces. Tell team to place their wall clock in front of their eyes so that they can know about timings, and they must have their bed on the side of room where they can see things, environmental things from window, so that they can improve their level of orientation. So I thought that I must make some video which can help medical students and other doctors for the recognition of delirium. Unfortunately, there are many professionals who are not very familiar with delirium. I remember when I was working at a children's hospital, some of very senior faculty, she asked me that delirium, kya delirium bachon mein hota hai? So delirium is a medical emergency. Delirium can occur in children, delirium can occur with adults, and very common it has been seen in elderlies, especially in ICU and medical settings, and also in surgical settings. So always be aware of delirium, recognize delirium. If you have psychiatry team, just request them to come over and see patients. There is some myth associated. Let me tell you a bit in detail that the role of psychiatrist is to see a patient dynamically, right? So we just don't have to assess delirium, but along with psychosocial parameters and ruling out other possible psychiatric diagnosis. So that would be a right approach to tell a psychiatrist to assess your patient, and then we can expect a favorable outcome. With this, I would like to thank you all.